Hello YouTube, this video is for those who are looking for an idea on how to do this assessment or taking classes at Capella University. This is assessment 1 for the class NHS-FPX6008, which is Economics and Decision Making in Healthcare. I took this class as part of my master's curriculum in Nursing Informatics. I hope you'll find it helpful. This is a title page. As you can see, this paper is about the impact of inadequate staffing on community healthcare economics. Please note that this is formatted according to the APA 7th edition. The impact of inadequate staffing on community healthcare economics. Economic factors are crucial in the healthcare industry, with policies and directions affecting community outcomes. Such a problem is staff shortages, for which various issues and outcomes may be observed. This report will focus on the economics of community healthcare due to poor staff turnout. I will first explain why this issue was chosen, the various impacts on the involved professions, organizations, and the community, and the existing gap that has contributed to this issue. Description of the issue and supporting data. Lack of sufficient personnel is one of the urgent economic problems in healthcare, and it hurts the quality and availability of services for certain population groups. There is a need for more professionals in the healthcare workforce, such as nurses, doctors, and other personnel, resulting in high patient-staff ratios, system inefficiency, and adverse patient health outcomes. Kangavi et al. 2020. Lack of staff is common in today's healthcare system, involving large institutions such as hospitals and small clinics. Furthermore, it has a stringent reflection on the quality of care, the standard of treatment delivered to the patients, and the overall satisfaction one can derive from the incurred healthcare service. Alderwick et al. 2021. Also, low staffing levels mean overworking the healthcare professionals within the institution, thus the effects extend to patient satisfaction besides causing dissatisfaction. According to a survey by the World Health Organization 2020, the U.S. is projected to experience a shortage of registered nurse employees totaling 1.12 million by the end of 2024. Alderwick et al. 2021. While only 9% of medical surgical nurses indicated sufficient staffing, this number spiked to 75% during the pandemic. Before COVID-19 pandemic, 54% of the medical surgical nurses reported a high level of burnout that rose to 58%. Ballard et al. 2020. Other factors causing this shortage include the increasing population, which means an increase in the proportion of people in the aging population, the need for healthcare services, among other issues, and high turnover in healthcare providers. Rationale for choosing the healthcare economic issue. The issue I chose for this report is the shortage of healthcare personnel because this problem affects the facility I work for as a registered nurse, and I have been observing it more often. In a single day, I witnessed the impact of staffing shortages, unhappy patients or clients, stressed and tired healthcare workers, and less than desirable health outcomes. Alderwick et al. 2021. This issue also relates to my strategic plan because my organization works towards increasing access to and eliminating disparities in healthcare services in our area. The decision to concentrate on inadequate staffing as an economic aspect of healthcare results from its increased importance in healthcare and profoundly influences patients' overall well-being. Ballard et al. 2020. However, poor staffing levels are not just a danger to patient care, but also lead to a rise in the costs of healthcare services. Eradicating this problem is significant in facilitating competent, secured, and efficient healthcare services. Analyzing the allocation of funds to staff shortages and gaps will enable proposals and steps to be taken towards maximizing the effective use of resources to promote better health within communities. Impact on work, organization, colleagues, and community. The consequences of failing to provide adequate staffing manifest in multiple facets of the healthcare setting. High patient turnover pressurizes healthcare workers and decreases their morale by increasing their workloads, burnout rates, and job satisfaction. Ballard et al. 2020. This is due to the problems that organizations experience in terms of patients' expectations, satisfaction, quality, and costs. Those stress challenges peer relationships, thereby negatively influencing collegibility and intergroup communication. Lastly, the community is compromised because patient satisfaction and comprehensive care are disadvantaged as they receive diminutive care at the right time. Identifying the contributing gap. This primary deficiency leads to insufficient staffing, mainly due to the healthcare workforce imbalance, which must meet the demand. The increasing healthcare demands of the population and the rather restricted number of healthcare workers cause the shift imbalance, feeding the staff deficit. Kangavi et al. 2020. Other reasons that can be pointed out include low recruitment and retention efforts, low healthcare education funding, and poor incentive programs for healthcare practitioners in disadvantaged regions. Combating this remains a vulnerable area that calls for a systematic, profound, and multifaceted approach to meet the latest educational standards and encourage healthcare personnel to work in demanding scopes to help underserved populations. Conclusion. In conclusion, insufficient staffing has emerged as a significant healthcare economic problem that negatively affects communities, personnel, institutions, and patients. Due to scarcity, the quality of care offered to those in need is affected, costs are higher, and there are restrictions on those services. Therefore, identifying the contributing gap through strategic workforce planning, investment in education and training, and policy intervention can go a long way toward negating the impact of insufficient staffing on community health. Ballard et al. 2020. A vital stakeholder interest is needed to work toward defining sustainable solutions that would establish an adequate health workforce that would help provide equal access to quality care to all members of society. This is the reference page. It is also the last page of the paper. Thank you for watching, and I hope you now have a better idea about how this assessment should look like for a submission. Thank you all. Boris Kierman. Bye.